Let's talk about seizures. So what is a seizure? An abnormal hypersynchronous. Stop there for 1 second. Hypersynchronous. So the pathology here is hypersynchronous. What does that mean? It means that actually on an EEG, an electroencephalogram, normally our rhythm, right, should be asynchronous. Asynchronous. So therefore, any period of time that you find on an EEG in which it is synchronous or uniformed is the pathology. That's the seizure. Fascinating. Our brain is supposed to be chaotic normally. And EEG is then going to obviously give you that type of measurement, right? But if it's hypersynchronous, this is not good. And so therefore, that's what a seizure is. And what the difference between a seizure and epilepsy, we'll get into that in a second. But right now, let's talk about the definition. So once again, an abnormal hypersynchronous electrical discharge of neurons in the brain. It's easy to read, but please understand the significance of. So what's an epilepsy? A tendency to experience recurrent, unprovoked seizure. The operative word, unprovoked seizures. Keep things simple. A seizure is hypersynchronous type of electroactivity over a period of time, maybe minutes, whereas epilepsy would be unprovoked type of seizure by definition. Once you get the definitions down, obviously we're going to get into further details. Let's move. So what's a generalized seizure? Generalized seizure, the entire brain is affected. Okay? The entire brain, generalized, versus focal. A seizure which affects the entire brain at once. And you can have primary generalization. You can have secondary, but at this point, current day practice, we don't really talk about this so much, huh? But our focus will be on primary generalization. With secondary, what we'll do is, when we get into focal, meaning to say you have focal portions of the brain, most commonly the medial temporal lobe, then at some point, a focal then can go on to secondary generalization. Partial. Now, partial is the focal, which means what? Only parts of the brain are affected. A seizure which originates in one area of the brain. Are you seeing the difference? Generalized, entire brain. Partial, aka focal. Current day practice, that's what you call it, focal. Can secondarily generalize. Allow the definition and allow the word to speak to you. At some point, sure, a focal could then go into generalized. You call that secondarily generalized.